Hello, hello, good afternoon, and happy Monday again. This is Dr. Maisha. By now, you all know who I am. I help doctors and medical professionals create profitable businesses from what they already know. So, if you've been with me for the last few weeks, you know that I've been doing the Doctors Thriving Outside the Box Beyond COVID series. And week 1, we covered telemedicine. Week 2, we covered cash-based practices. And I've been doing this because, of course, through all of what's going on, I've been hearing a lot of docs talk about wanting to step outside the box, wanting to own their own businesses and create practices by their design. And so I want to make sure you know all your options. So this week, we are talking about integrative medicine. And I have to say, it's one of my favorite things to talk about because it is my clinical background. I'm a family doc and then cross-trained in integrative medicine back in the day before it became super trendy and popular like it is now. So before we jump in, go ahead and if you're listening to me on live on Facebook, like and share this with someone you know this will be valuable for, someone you know is thinking about starting their integrative medicine practices. If you are listening to me live on YouTube, go ahead and hit the subscribe button now so that you can get updated this week for each of the live trainings and also for any of the other empowerment videos that I release. So now jumping in, integrative medicine, one of the reasons I chose integrative medicine is one of the top potential places or careers outside the box to move into is because it is growing in popularity just as much as the direct primary care practice. So DPC and integrative medicine kind of rival each other, and there's some crossover even a little bit. More and more docs are including integrative medicine, the integrative therapies as a way to enhance patient care, and also because this is a demand, let's face it. Patients are wanting more integrative solutions, and the question is, are you set up to provide those integrative solutions? So the first thing I want to do today on today's live is to really distinguish integrative medicine and its cohorts, right? Because when we talk about integrative medicine, it really can encompass a lot of things. So I'm gonna just create a little bit of an overview of what is considered integrative, what are considered integrative modalities, and do a little bit of compare and contrast so that you understand the terminology. And the reason that's important is because once you're clear about what they are, you might know what you're most attracted to and then what pathways to go down. So let's talk about integrative. Integrative is sort of the overview term of integrating someone called non-traditional, I call more natural, non-Western allopathic modalities into the allopathic modalities. So inside of that, you have a couple of subsets. You have a couple of different terminologies. A lot of people talk about functional medicine, and functional medicine could be considered under the umbrella of integrative as a subset. Now, what that looks at is functional medicine basically looks at what's missing in the body's biochemistry, and then uses diet, uses nutraceuticals, uses vitamins and minerals and things like that to help the body heal by returning it to its natural homeostasis. All right. And that's like the nutshell version of it. There's more to that, but that's the nutshell version. And then you have lifestyle medicine, and lifestyle medicine is also something that can be categorized under the integrative, approach. And lifestyle medicine involves using, you got it, lifestyle, and things like mind-body practices, lifestyle like diet, exercise, mind-body approaches, and things of that nature, yoga, breathing, things of that nature to help prevent and eliminate disease, right? So it's very much in what you're doing in your life to enhance your health domain, okay? And then you have a subset that's anti-aging. And that subset is also considered an integrative approach, and it goes a little bit more into the cutting edge. And so you're using modalities more like bioidentical hormones and PRP, which is platelet-rich plasma, and even stem cells for a more regenerative approach. So anti-aging medicine focuses more on regenerative approach, and so that there's those three things. You've got your functional, you've got lifestyle, you've got anti-aging, and then you've got everything in between, right? So integrative, those are three subsets that people often talk about, but integrative encompasses all kinds of other things. It's a vast amount of things. Acupunctures, which I happen to be trained in, hypnosis, which I also happen to be trained in, homeopathy, energy medicines, herbal medicines, aromatherapy. It's like a very vast and wide space to step into integrative medicine. And so why it's important is when you're thinking about, wow, I want to do an integrative practice, in what way do you want to integrate? What appeals to you most? What interests you the most, right? And so now that you know what these are, you can begin to kind of think about, well, what is it that interests you the most? And I'd love to hear from you. Like, now that you know this, what is it that you feel most drawn to as a potential integrative practitioner? What are your takeaways from today, this first episode? Post in the comments. I want to hear from you. Okay. And what action are you going to take to gain more knowledge about what you're most drawn to and to move the needle forward? All right. So that's what I want to talk about today. Tomorrow, we're going to talk a little bit more about the next steps that you need to be taking, or the things that you need to be considering when starting an integrative medicine practice. And of course, by now, some of you already know that you want to jump into an integrative medicine practice. You're super serious about taking that next step. And if that's the case, I invite you to check out the MedE University that we just launched. And you can do that by going to medeu.nextlevelphysicians.com. And what that is a comprehensive curriculum, a business by design curriculum that is designed to help you to move into starting your programs, starting your business, marketing, sales, and it's housed inside a low monthly membership. And you can actually get a 14-day free trial on this. And like I said, you go to medeu.nextlevelphysicians.com. Or if you feel like you need a little bit more direction on which way to go, you can schedule a strategy call with me by going to drmaisha.com/meet-me. It's right on the screen here. And so it's not clickable, so you have to actually enter it. It's right there. So just post in the comments. I want to know what most attracts you. What are the questions you have about integrative medicine? We're probably going to cover some of those questions during the week, but post your questions. It'll inform maybe how I go about the series, tweak and adjust, because that's what I do. I meet you where you are. So look forward to seeing you tomorrow on our next video. And until then, have a great rest of the day. And I will see you tomorrow. Namaste.